Hi, how are you doing? In today's video, I want to show you a cause of pain in the glute, pain in the leg, which is often confused with sciatica and hip problems. I want to show you how to test if this is the cause of the pain you're feeling and how to improve this problem. If you don't know me, nice to meet you. I'm Dr. Alexander Mota. I'm a physical therapist, I'm an osteopath, and it's very good to have you here. Take a look at this question, Lucia commented. I have a lot of pain in my sciatic nerve and in my spine. I feel like I have a lot of gas in my muscles. What should I do? Help me, please. Thank you. I've already made several videos talking about sciatic nerve problems, about hip problems. And the thing is, there are many people who do the exercises, get treatment, take medicine, and it seems like this pain never goes away. Or if it does, it comes back. The thing is, many times the problem is a muscle called the Quadratus lumborum. I made this quick little drawing here. Let's understand. Imagine you're looking at someone from behind. Here we have the pelvis, the hip, the sacrum at the end of the spine. Here we have the vertebrae of the lumbar spine, and here is the last vertebra of the thoracic spine and the last ribs. And this muscle, the Quadratus lumborum, is located right here next to the lumbar spine, connecting the ribs to the pelvis. And whenever there is an imbalance in our body, some muscles start to accumulate tension, becoming stiffer and more painful. And something called referred pain starts to appear, which is pain that shows up in other parts of the body because of this muscle. And here you can see a map of referred pain, pain that can be caused by this muscle, the accumulation of tension in the Quadratus lumborum. Pay attention, because this pain is that pain that starts in the spine and goes down to the buttocks. And many professionals and many people right away say that it's a problem with the sciatic nerve. And if you still have doubts, remember that I recorded a video showing how to test the sciatic nerve. I'm leaving it here in the card for you to watch after this video. And in this other map, also of referred pain, from the same muscle, it shows that little pain on the side of the hip going down to the thigh, sometimes. And that is often mistaken for a hip problem, gluteus medius tendinitis, hip bursitis, or trochanteric bursitis. So, if you feel pain in these areas and it seems like nothing works or nothing works for very long, let me show you how to test if the Quadratus lumborum is causing this pain and how you can improve it. The way to test this muscle is to see if it can stretch, elongate. When the muscle is accumulating tension, it doesn't allow you to make the movement, it ends up limiting you. Either because of pain or simply because of the tension itself. It feels like something is restricting the movement. Let me make a quick drawing on myself here so you can understand what the movements are and how this test is going to work. Guys, you have no idea how hard it is to draw on your own back, but look how it turned out. You can get an idea. Let's go. The Quadratus lumborum muscle is present on both sides, on the right side and on the left side. Here I only drew the right side, so let's imagine that the pain I'm feeling is on the right side. Or that little pain going to the butt, or that little pain going to the hip. To test this muscle, we have two ways. The first is simple. You put your hands on your waist and come here near the spine, looking for sensitive spots, painful spots. If you find a spot that's very sensitive, like it's hurt or a trigger point, in other words, when you press it, it reproduces the pain. It hurts in the butt, it hurts in the hip. That's already a sign that yes, the pain you're feeling is caused by the Quadratus lumborum muscle. The second way to do this test is to try to stretch this muscle. For that, you'll stand up, keep your arms here on the side of your leg, and you'll lean to the right and to the left to see how far you can go down. So you'll stand up, keep your hands here at your sides, and see how far you can reach. Going down as if you're trying to touch the side of your knee. Lean to the right, lean to the left. Remember that the pain is on the right side, so if the Quadratus lumborum is accumulating tension on the right side, when I lean to the other side, when I lean to the left, I'll feel like there's something here in my back holding the movement, like it's pulling. Or I might feel pain when I lean to the left, like something that's injured is being stretched. The pain is on the right side, so you test it by going to the left, lowering your left hand as if you were going to touch your knee. If you can go down much less on the left side, or if when you go down you feel a pulling sensation in your back, or if it hurts, Yes, that's a sign that the Quadratus lumborum is causing this problem. And I've also mentioned that this movement of leaning to one side or the other has to do with the sacrum. I'm leaving another video here in the card where I show how to improve the sacrum and the sacroiliac joint. The first way for you to improve this problem is by finding exactly that most sensitive spot. When you find this sensitive spot, you should apply light pressure. I want it to cause mild pain or preferably no pain at all, okay? If you're feeling strong pain. You're pressing too hard, loosen that finger, ease up on the pressure, apply lighter pressure. When you feel a mild, bearable pain or preferably no pain, you should maintain that pressure and also tilt to the same side. Keep this pressure here for 90 seconds. When you come back, you'll see that the spot is softer, less tense, and the pain has decreased a lot. You can repeat this exercise up to 3 times. If it eased, press harder. If the pain comes back, lean, wait. 90 seconds, then return, and you can repeat a 3rd time. Go even deeper. Lean, wait for the pain to decrease. Wait the 90 seconds and return. I'm still amazed by this drawing. It was really hard. Come on, guys, appreciate it. Subscribe to the channel, turn on the notification bell, and select all notifications because it's not easy, is it? In the second exercise, you're going to massage these muscles. Massage both sides using these knuckles of your hand. When you close your hand and make a tight fist, you see these little bone points, and they're great for massaging your back. So you're going to place these knuckles on each side, and you can massage up and down, or you can massage in a circular motion. Do this massage for 30 seconds or up to a minute if you're feeling that good sensation, that relaxation. With the massage and an extra tip, see what works best for you, whether it's doing this massage standing up, sitting down, or even lying on your stomach. Everyone is different, so try it out and see what feels best. And for many people, this muscle is so sore that you can't even do the first or second exercise. So in these cases, you'll do this 3rd exercise. And the 3rd exercise you'll do lying down. But pay attention first, you sit on the bed, somewhere comfortable for you to lie down and get up. And imagine the following. If the pain you're feeling is on the right side, you'll lie down with the side of the pain facing your torso. In other words, if I'm feeling pain on the right side, I'm going to lie down on my left side. And here, you're going to do the following. Lying on your side, you're going to cross and interlace your fingers. Like this. Place it here on your right chest and let the weight of your arm rotate your body as if you were turning your chest back toward the ceiling. Go slowly, only as far as is comfortable for you. When you reach your limit where you feel the stretch, you'll notice it's stretching your quadratus lumborum area, but it shouldn't cause any pain. You're going to stay in this position for 3 minutes, breathing very gently, calmly, and relaxed, taking slow, deep breaths. Every time you take these slower breaths, especially when you exhale, you're helping to stretch, lengthen, and relax the quadratus lumborum, so just stay here, enjoying and feeling the relaxation. And I want to tell you about 2 habits you might be doing that could be causing this buildup of tension in the quadratus lumborum. First, if you sit with your legs crossed, for example, if you have pain on the right side, your right muscle is accumulating tension. Notice if, when you sit, you're not crossing your right leg over your left. Or, many men do this. They put a wallet, sometimes a very big wallet, in their back pocket. And then it's like you're sitting on a cushion. Your pelvis will always be out of alignment. And then what happens to protect your spine is that the side that's higher, more elevated, that muscle starts to tense up, to contract more. So, let me know in the comments if these exercises helped you, if they helped you, if you learned something new. Thank me. By clicking like down here, your like helps you, helps other people, and helps our channel grow. And I say this channel is ours because I want you to share these tips and all the tips from the channel. For those who are in pain, share it in WhatsApp groups, send it to someone you know who feels this pain. I'm leaving a video up here where I talk about another muscle that's largely responsible for back pain and hip pain. Just click and watch, and down here, there's a whole playlist about hip pain for you to binge watch. If the video is there, it can help those who have hip pain. I'll stop here. A big hug and see you next time.